This PowerPoint will cover the future of nursing. This also goes along with your educational advancement module. So think about the future of nursing. Where do you see nursing in the future? Nursing has already begun to require higher education, which started back in 2010, and technology has definitely incorporated into the nursing field. With the Affordable Care Act that was passed by Congress in 2010 to help provide quality healthcare to all Americans, nurses will continue to play an increasingly important role as healthcare needs continue to expand. Nurses have become more well-educated, with about 80% of RNs holding bachelor degrees. This is up from 50% 10 years ago. As some of the most trusted professionals, nurses excel at connecting with the people that they care for. Nurses have a variety of responsibilities and skills, so it's quite unfortunate that they are left with only 20% of their time at the bedside. If patient care standards and job fulfillment are to be maintained or improved, then there will be needs for change. There's more than just a place for nurses in the future. There's a significant demand. A critical shortage, if not already here, is expected within the next 5 years. And with COVID-19 taking place, this has likely only shortened that timeline. It's predicted that 500,000 seasoned RNs will leave due to attrition or retirement by 2022, while the need for nurses will increase as baby boomers grow older and require medical care. Nursing leaders must seek to leverage the momentum from the renewed faith in nurses to advocate for better safety standards in hospitals, in clinics, and other facilities, and nursing staffing that is done smarter. There is a significant opportunity for improved education to produce stronger nurses that will help to fill the gaps and to deliver better health care, especially as it pertains to new grad nurses getting ready to enter the workforce. The healthcare environment is changed, and in public and institutional policies at the national, state, and local levels. The goal of change is to have more effective, healthcare systems. According to the Institute of Medicine, they have blueprints to help provide better healthcare systems. Like, for example, number 1, they want to ensure that nurses can practice to the full extent of their education and training. Nurses should also achieve higher levels of education and training through an improved education system that promotes seamless academic progression. It also recommends that nurses should be full partners along with physicians and other health professionals to redesign health care in the United States. Now, this is very, very important because it's wonderful that they are including nurses in having decision making, because nurses are on the front line. We're the ones that are there 24/7, not the healthcare provider. So it's nice that they're including our input to say, hey, let's see if this is going to, affect patient care. Are you, as nurses on the front line, able to do A, B, or C? Well, the nurses may come back and say, absolutely not, it's not going to work. We don't have the resources or the ability to do that. So it's, like I said, it's very important that nurses are full partners in making any kind of decisions. Remember, this is all an interdisciplinary team workforce together to provide the best patient outcomes. Now, what do all these changes mean to the nurses? Well, even though this is very encouraging, there are some systems that need to change for nurses, including changes in compensation towards procedures and productivity. The shift work mentality, often found with hospital nurses, needs to change, because nurses taking on more responsibility will mean greater accountability. Change is hard, especially for nurses, because it can be scary, but it also can mean progress. It brings improvement. Change is hard for anyone, but you have to look at it with an open mind, because remember, we are nurses to provide the best patient care possible. What are some benefits from change? Well, like I said before, there is progress. It can definitely have some improvements to be made. It can be energizing, especially when you're kind of getting, settled in the same old. It creates an opportunity, and it also creates learning. The change theory, which is by Kirk Lewin, talks about the different types of change: unfreezing, moving, and refreezing. So you have to think, are you ready for the change? In today's world of change, the need for change could happen in weeks or less. The first step is to accept that there needs to be a change. So people are unfrozen, moving towards a new way of being. Change, again, is a process. And as you continue to move, you can see new levels and thoughts, behaviors, and feelings. And then the last step is refreezing, which means that you are accepting the change and then you maintain it into the future. I have provided a link here for you so you can read more about this change theory. When you continue to think about change, you think about nursing again, because medicine is always evolving. Change is also happening with different kinds of viruses and bacteria. Think about all of the MRSA that's out there, because all of these germs and bugs, they're evolving as well, and they're evolving and changing faster than our medical can actually catch up with them. So when you think about the medical team, as far as like scientists, pharmacists, all of them, they're constantly having to try to catch up with these changes that are happening so they can try to be on top of everything, because again, a lot of these bacteria are just evolving so much faster than we can catch up with. And the medicine out there, or the medical, needs to be as caught up as possible to provide the best patient care. Also, you have to think about the changes that have evolved with patients and how we provide our interventions for them. I remember back starting as a new nurse, and a patient would have a laminectomy, and we would not let them move for like 2 days. And even if we did, we'd have to, what we called, log roll them back and forth, because we were really trying to protect their back area. Well, sure enough, because of change and research and evidence-based practice, it has shown that we get those patients up the minute that they are waking up from anesthesia, because they have better outcomes. The faster that you can get them moving, the better the outcome that the patient will have. If, for example, you are a leader somewhere that you're working and you are doing a staff development education, and you want to present something that there's going to be a change maybe on your unit, be prepared to have resistance, because like I've said before, it's very hard for a lot of people to change. But make sure that you are explaining to your staff how these changes are going to provide better outcomes. And ask your staff for some input. A lot of times when you are allowing other staff to have their say or their input, you will actually get more compliance because they feel that they're part of the team. Educational advancement. This talks about how nurses should achieve higher levels of education and training. This is very similar to what we discussed before from the IOM. Nurses should be a partner with the physicians and other healthcare professionals. And nursing education should serve as a platform for continued lifelong learning. So, conceptualizing the role of nurses through higher education and training, this will produce an adequate number of well-prepared nurses who are able to meet the current and future nursing shortages. This will furthermore help to partner with other professionals and to complete our goals as nurses for lifelong learning. Another thing with the Institute of Medicine with the Future of Nursing report, what this did is, this is a report that came back out in 2010. And what they recommended is that they came up with what's called an 80-20. That means that 80% of nurses by the year 2020 will have a BSN or higher education. And now we're already in the year 2021. And that's why you see a lot of the acute care facilities, and now even some places that don't even hire LVNs, they want a BSN or higher. Those LVNs that were working in the acute care or the facilities that were requiring this, they were grandfathered in, so they did not lose their positions. In fact, they are highly encouraged to continue their education. So think about this. Why was the IOM pushing for higher education? What were they wanting to gain out of that? The reason for this change is because the higher the education that a nurse has, and with the more complexity of these patients that we are caring for, it would produce better nurses to be able to make better decisions to provide a better outcome for the patient. Now, do some nurses or some places or even people agree with this? Not necessarily, but it does not mean that you are not receiving a great education as an LVN. In fact, we are providing you with sometimes even higher level to prepare you to go back to school. The program that you're in currently is a very rigorous program, as you have already learned because you're in your last semester of school. A lot of the BSN programs have so much more theory than the community colleges do with the LVN or the associate degree RN programs. So even though theory is wonderful and it is helpful, you are provided with an education where you have so much more hands-on and bedside, being at the bedside with your patients. So you are learning through experiences. And this is what's also going to prepare you to be a great nurse.